Hi, today we are going to talk about bad breath. Bad breath, also known as halitosis medically. Halitosis can be embarrassing and in some cases may even cause anxiety. Bad breath can be brought on by bad dental hygiene practices and may also be an indication of other health issues. Your diet and other unhealthy lifestyle choices might also trigger bad breath. So today we will discuss here some reasons of bad breath. Number one, food. The breakdown of food particles between your teeth and in the area around them can promote bacteria and give off a bad odor. Additionally, eating foods like onions, garlic, and spices might contribute to bad breath. Following digestion, these meals enter your bloodstream, travel to your lungs, and have an impact on your breathing. Number two, dry mouth. Saliva helps clean your mouth by eliminating particles that contribute to unpleasant odors. A condition known as dry mouth, also known as xerostomia, can cause less saliva to be produced, which can lead to poor breath. If you sleep with your mouth open, a dry mouth which naturally results in morning breath gets worse. Salivary gland issues and certain disorders can also contribute to chronic dry mouth. Number three, poor dental hygiene. If you don't brush and floss every day, food particles stay in your mouth and cause bad breath. Plaque, a sticky colorless film of bacteria, develops on your teeth. Plaque can irritate your gums and potentially lead to the development of plaque-filled pockets between your teeth and gums. If it is not removed by brushing, the bacteria that cause odors can also be caught on your tongue. Number 4. Tobacco goods. Smoking produced a bad taste in the mouth on its own. Gum disease is another cause of poor breath and is more common in smoker and user of oral tobacco. Number 5. Medication. Some drugs might cause dry mouth, which can result in bad breath. Other can be metabolized by the body to produce compounds that are then exhaled. Number 6. Infection of the mouth. Bad breath may arise from surgical wounds following oral surgery, such as tooth extractions, as well as from tooth decay, gum diseases, or sores in the mouth. Some medical diseases can have a side effect of bad breath. It could be brought on by lungs, nose, or throat infection, or chronic sinusitis, or chronic bronchitis, or digestive system problem. So we have some solution to prevent from bad breath. Number 1, practice proper dental hygiene regularly to lessen bad breath, prevent cavities, and minimize your risk of developing gum diseases. Depending on the cause, further treatment option for foul breath can differ. Your dentist will probably suggest seeing your primary care physicians if it is determined that the source of your bad breath is a health issue. Number 2, toothpaste and mouthwash. Your dentist can suggest a mouthwash that kills bacteria if the cause of your foul breath is plaque well up on your teeth. Number 3, dental diseases treatment. A gum expert may be recommended to you if you have gum diseases. Gum diseases can cause your gums to remove away from your teeth, leaving behind deep pockets that overflow with germs that produce bad odors. Sometimes harmful bacteria can only be eliminated by professional cleaning. Additionally, since damaged dental restorations are heaven for bacteria, your dentist can advise replacing them. Number 4. Brush your teeth after a meal. Keep a toothbrush at work for use after meals, at least twice daily, especially after meals. Brush your teeth using fluoride containing toothpaste. It has been demonstrated that using toothpaste with antimicrobial characteristics will lessen bad breath odors. Number 5. Make sure to floss every day. By properly flossing, you can reduce bad breath by removing food particles and plaque from between your teeth. Number 6. Prevent dry mouth. Avoid using tobacco and consume lots of water instead of coffee, soft drinks, or alcohol, which might cause your mouth to become drier. To encourage salivation, chew gum, or suck on candy, preferably sugar free. Your dentist or doctor may recommend an oral saliva stimulating medicines or preparation made of artificial saliva to treat chronic dry mouth. So now we will tell you some natural cures for bad breath. Number 1. 3 times a day gargle with a mixture of 1 teaspoon salt and a glass of water. Number 2. Mix a pinch of baking soda into your toothpaste. It keeps away bad breath. Number 3. One of the most popular ways to treat bad breath is by chewing on fresh mint or parsley leaves. Number 4. Black tea without sugar should be took since it also helps to clear up bacteria from the mouth. Number 5. Use a half teaspoon of apple cider vinegar diluted in a glass of water as a mouthwash to get rid of foul breath. It works incredibly well. Thanks for watching.